Hi everyone, I'm Lauri East, and I've been looking at sexuality and sex education among adolescents with physical disabilities. I got into this partially because I'm studying to become a certified sex educator. That's always been my goal. That's what I'm working towards right now. But I've also worked as a personal support worker for over 10 years, working with kids and teens with all kinds of disabilities. So this was sort of the natural kind of coming together of my two passions. And when I first started to explore this topic, I started to think, well, how do we learn about sexuality in general? And I think for most of us, we learn about sex from lots of different sources. So we learn about it from our parents, from our peers, from the media, as well as formal sex education at school. You may be familiar with images such as this. They're often used in sex ed. And I think images like this are really teaching kids that this is the way your body should look. This is the way your body should function. And basically it's saying that this is what people who have sex look like. Able-bodied, heterosexual, white, etc. So it was really this idea that kind of sparked my research question, which was, well, what's the experience of learning about sexuality like for an adolescent with a physical disability? And then in turn, how does that experience influence the way they see themselves as a sexual being? So I started looking at the research, and I can tell you there's not that much. It's mostly based on cognitive disability. It's quite outdated, and it's mostly quantitative. But when I did look at it, I started seeing that when disability and sexuality were put together in the same sentence, it was very negative. It was mostly about vulnerability, being naive, childlike, and there was this myth of asexuality. So somebody who has a disability can't have sex, doesn't have any interest in sex, has no desire whatsoever. However, when I looked at general adolescent sexuality, it was all these things about promiscuity, high-risk sexual behavior, and so there really seemed to be this us versus them dichotomy. Sort of people with disabilities were really marginalized as a group separate from everybody else. So now I'm starting to think, all right, well, how am I going to study such a complex and sort of multifaceted topic? So I knew that I really wanted the voices of the youth, or the stories, if you will, to be heard. And I also wanted there to be an opportunity for the youth to really share with me what they felt was important. So I decided to do narrative interviews. I interviewed 4 youth between 15 and 20. They had cerebral palsy and spina bifida. And then I also, because I said it was a really sort of multifaceted topic, I wanted to get lots of different perspectives. So I also interviewed 4 parents, and I did a focus group with health professionals, an occupational therapist, a nurse, a social worker, and a teacher, who all worked at Thames Valley Children's Centre, which is a big children's rehab center here in London. So, many challenges. I thought, for sure, this is such a sensitive topic. Ethics is going to be my biggest challenge, definitely. And even though ethics, I mean, it took a while, it actually went fairly smoothly. I was quite surprised. My biggest challenge, for sure, recruitment. And I don't know why, but nobody ever warns you about how hard recruitment actually is. I don't know why we don't talk about it. It was very, very difficult. Firstly, I was dealing with a very small population, so that's going to make it difficult to start off with. But I also learned a lot of things that you can't trust anyone else to do your recruitment for you. I was supposed to have some staff at Thames Valley recruit for me. I later found out that they were giving all kinds of wrong information. They were telling the youth that I was running a sex ed program that they had to come to every week. Nobody was interested. So that was a little frustrating. And my other issue with recruitment was trying to find people with the right criteria. So one of my criteria was that they had to use a mobility device, either a wheelchair or a walker. And so I was at sledge hockey. I don't know if any of you are familiar with sledge hockey. So it's hockey, but you're sitting in a sled and you're strapped into it. And I was talking to one of the dads, and he was saying, yeah, my son will be great for the study. You should talk to him when he comes off the ice. And I'm thinking, great. So I get all excited. I got my papers ready to go, and I walk down to the ice. And you can't tell what disability they have because they're trapped in these sleds. Anyways, I'm all ready, and he unbuckles himself, and he walks out of the sled, walks over to me, and I just kind of looked at him and didn't really know what to say. And so I said, do you use a mobility device? And then he just looked at me all confused. He's like, I just use my legs. Not something I was expecting. So there were many surprises that came about. I would say probably the first surprise was that sexuality was really just the tip of the iceberg for so many other issues that came up. Everything from peer issues, isolation, expectations, stigma, misconceptions, everything came out. And a lot that was based on societal views of disability. There seemed to be this sort of recurring theme that people with disabilities were treated as less than everyone else. So one mom said, here, I think they see them as a non-person in some ways. And this became really apparent when we talked about this myth of asexuality. None of the kids felt that they themselves were asexual. However, they were all very aware that this misconception was very prevalent in society. Another big surprise was actually how similar the youth with disabilities were to able-bodied youth and what they wanted and what their biggest challenges were. What upset them was that nobody saw these. So here Lily says, a lot of people just assume that people with disabilities already have the worst thing that they could possibly have, so what are they doing worrying about these smaller issues? And yet it was those smaller issues that was their main concern. They were worried about who they were going to take to prom, fitting in at school, they had body image issues, not the ones that I expected. I was thinking, like many of you, that they'd be self-conscious about, you know, being in a wheelchair, their disability. It was, my thighs are too big, I don't like my belly, I have acne. That's what came up. But it really bothered them that nobody ever asked them about these things. All they asked them was about their disability. And the final surprise, which, oh, and by the way, this is where the shameless self-promotion comes in. What surprised me the most was that people actually wanted to talk to me. And not just wanted to talk, but it was actually a really positive experience for them. So one girl during her interview actually said to me, you know, I'd never talked about this with anyone before. And she's like, thank you so much for talking to me. I feel so much better now. And, you know, I kind of just thought they were doing me a favor by talking to me, but in actual fact, I realized that by talking to them about sexuality and asking them about their own sexuality, I was actually validating them as a sexual being and making it okay that this was actually an important part of their lives. I'm doing a whole master's on it. It's got to be somewhat important, I guess. So that was definitely a big surprise for me. So what are the solutions? And we had so many ideas. One thing that really kept coming up was that sex ed has to be so much more than just the nuts and bolts, you know, the anatomy, the diagrams, safety, everything, you know, and things like peer pressure and media influence and dating and socializing and all these aspects need to come up. But I often think this is kind of for everybody. I think sex ed in general needs to cover all those things, not just sex ed for people with disabilities. Another issue that came up both from the parents and the youth and the health professionals is that increased need of the role of the health professional in sex ed with these kids. You have to remember these families are very heavily involved with clinic. They're at Thames Valley, for example, a lot, and they have long-standing relationships with their healthcare providers. It's the perfect opportunity for them to be able, they know these kids well, to be able to bring up those sensitive issues, those questions that no one can answer, and really, again, it helps to validate the fact that these kids are sexual, they deal with these issues. Not one kid told me that the doctor or nurse had ever talked to them about sexuality. Every single one said the same thing. Nope, it's never come up, it's never come up. And I was shocked, like even 19 and 20-year-olds, no one had ever asked them, are you sexually active? Do you want to be on birth control? It had never come up. I found that really surprising. So, in conclusion, oh, this went a lot faster than I expected. I definitely think there needs to be a lot more research in this area, specifically qualitative research. I think it captures something that quantitative research just really can't capture. I think I've learned that everybody's sexual, that everybody deserves really high quality, comprehensive sex education that's really geared towards their own individual needs. And I think sex ed is so much more than just teaching a kid to, you know, put a condom on a banana and just calling it a day. So, thank you.